Hi, it's Liz Calloway. I'm at 360 Healthcare, and I'm with Dr. Janine Rummel here, and I'm really excited to hear more about laser therapy. It sounds very sci-fi, but it does a lot of cool things. So tell us more about what this is.
Right, so cold laser is what we use at this office. A lot of times people think of hot laser.
Yeah.
Like we think of surgical procedures.
Yes, right.
So this is just like it sounds. It's a cold laser. So all people will feel is just this probe on the skin, which is fantastic.
There's no heat, there's no pain. Do you feel anything? It's just a light?
So since it has infrared in it as well, you may feel like a little bit of vibration from it, but that would be at max what you would feel.
Now, what does infrared light do? Like, how is it actually doing something?
So infrared works as a healer. So that's going to have the deepest penetration into the skin to really try to heal muscles, tendons, ligaments, because we're using this mostly for different pain conditions, joint issues. It's a great healer. So when we think of having surgery and we don't want to have an incision that takes a long time to heal, or we don't want to form a lot of scar tissue, this would be a great way to go.
So give me an example of a problem that someone could benefit from this. Like,
sure. So I could use an example of a patient this morning.
Yeah.
Had a foot and ankle issue, and an ankle sprain, which is really common in this area. Right, we step out of the car, we roll our ankle, and then it swells. Well, what happens to all of that soft tissue is it never fully heals. So that's why a lot of times people then have that ankle hurts
like a weak
forever
ankle.
and a weak ankle. So the goal of the cold laser, this cold laser in particular, is to help rebuild those tissues. So it's going to work a lot with the different colors that it emits. The red being the biggest one is really helpful for collagen production. And collagen is what makes our muscles, tendons, ligaments, bones, it makes it strong.
All right, so we talked about the fact that it can heal. What else does it do, infrared light?
So the infrared, that's the big thing, it's healing. So it also has in the cold laser a red and blue diode. So the red diode is for collagen. And really working on the mitochondria. So inside of the cell, we have what are called organelles.
It's working at a cellular level?
At a cellular level,
And you feel nothing?
And you feel nothing.
Okay. Well, can we see?
Yeah, absolutely.
All right, so we're going to turn off the lights. We're going to go into the dark here, but you need to cover your eyes. Why is it important to cover your eyes?
Right, so we cover the eyes because since it is a laser, it could go into our eyes and affect our retina, our overall vision. So you can see that red diode and blue diode. So I've got it set on both of those right now, and the infrared, which we can barely even hear, is also going at the same time.
So if I put my hand there?
Yeah.
Okay, so it would just kind of...
Right, and if I was going to use this on a point of pain, it would be right over an area. It doesn't even need to be touching the skin. There's a lot
And how long would you do this?
Right, so treatment could last anywhere from 5 minutes to 20 minutes.
It depends on the level of the injury?
Yep.
Now, you mentioned the difference between the blue light and the red light. What does the blue light do? Right,
so the blue light, just the blue light, is going to work on a microbial level. So this is going to be really helpful as an antibacterial, antiviral, antifungal, right? Trying to kill especially the things on the skin surface. So what's nice is I do have different probes. So these can be placed in the ear, in the nose, in the mouth, especially this time of year with respiratory issues, sinus issues.
So if someone's having an issue with congestion or something like that, they can come and you would use a certain probe to get up and in there.
Absolutely.
Now, what about things like acne? It sounds like it would work on that.
Sure. This would also work on any skin condition as well. I stick more with, I leave the skin to my estheticians that we do have here. And I focus more on overall if there's joint pain or if we're trying to get rid of an infection.
But they would use the same type of instrument?
Same type of tool, absolutely.
Now, what about for people who might have like a nail fungus?
Sure. Again, we could use this, absolutely, in conjunction with some of the other treatments that we have in the office.
That sounds good. Now, the red light is, now explain to me that.
So if someone we'll go to the red light, yes. So this red light is really good, again, for creating more collagen production. We could also think of collagen as what keeps the skin all nice and tight, and that's what everyone is searching for.
So this could be an anti-aging thing where it helps fluff up the collagen to plump up the wrinkles, the lines and the wrinkles. And then this also helps.
We use
heal.
this more on a functional than a fashion.
Okay.
We do offer the fashion cosmetic aspect of the laser with other treatments that we have here. But this laser in particular, we would want to be using it because it does penetrate deeper than just the skin surface.
And it's pain-free.
Yeah.
I like it.
Yeah.
All right, so if you want to find out if laser can help you with whatever ails you, you can give 360 a call, ask for Dr. Rummel here, and how do they get in contact with you?
Right, so you can call our office here at 843-692-9243, and we can absolutely get you set up with an appointment if you want to come in and have the cold laser performed on you.
All right, and 360 Healthcare is located at 4810 North Kings Highway in Myrtle Beach. You can also find them on Facebook and on the web.